Now we will discuss the pathophysiology of the peptic ulcer disease. For the normal, there must be a balance between the mucosal defenses and aggressors. Mucosal defenses includes the bicarbonates, mucus layer, prostaglandins, and mucosal integrity. Mucus layer basically act as a barrier to the damage. Bicarbonates are basically chemical antagonists of HCl. They are very abundant in the mucus layer, so they prevent the acidic damage or autodigestion. Prostaglandins basically they are the cycloprotective. They protect cell. They increase the blood flow. They increase the mucus secretion. They directly inhibit the gastric acid secretion. The fourth one is mucosal integrity, that is maintained by the tight cell junction so the acid may not pass or penetrate through them. Whereas H. pylori, NSAID acid, and pepsin they act as aggressors. Peptic acid ulcer disease occurs when there is an imbalance between these aggressors and these mucosal defenses. The first and most important risk factor of the peptic acid ulcer disease is Helicobacter pylori. It is basically gram-negative bacterium, spiral bacterium. It is one of the most common cause of the gastritis. They are basically cytotoxin. They are toxic to the living cells. They break down the mucosal defenses. They increase the gastrin acid releasing peptides. What gastrin releasing peptides do? They basically regulate the gastric acid secretion. They also decrease the bicarbonate secretion. And we have already discussed that the bicarbonates are responsible for preventing the acidic damage and autodigestion. The second aggressor of the peptic acid ulcer disease are NSAIDs. NSAIDs basically they're the patient who are having the NSAID for the longer period of time. The most common adverse effect they face are peptic acid ulcer disease. NSAID basically inhibit the prostaglandin synthesis, and we have already discussed that prostaglandins are cytoprotective. They increase the blood flow, they increase the mucus secretion, they directly inhibit the gastric acid secretion. So whenever a patient is having the NSAIDs, NSAIDs will inhibit the prostaglandin synthesis. In turn, there is a disruption in the functional mucosal integrity. There is a decrease in the mucosal blood flow. One of the another effect of the NSAID is they cause the direct GI irritation because they themselves are acidic. For example, if a patient is having the aspirin is itself acidic, so it causes the direct GI irritation. And third aggressor, that is smoking. Smoking basically stimulates the gastric acid secretion. They cause the alternation in the mucosal blood flow. They decrease the mucus secretion. They decrease the prostaglandin secretion synthesis. So they basically cause the decrease in the mucosal defenses. Please subscribe my channel, like my video and also share it. And also follow my Instagram page, that is Medicine All in One. Thank you.